This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Good evening, Southeast Texas. Thank you for joining for another edition of Ask the Doc. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. Happy New Year. We have a question for today. I have a lump behind my left ear. It's been there for some time. When should I become concerned? You know, we all get those lumps and bumps periodically that we feel, especially on our face or our groin area or our chest. When do you get concerned? Most of the time, those are related to what we call lymph nodes, which is a part of your immune system, which is the immune system there to protect us against infections such as COVID-19 or any sort of bacterial infection, urinary tract infection, etc. Most of the time, it's just doing its job. It's automatic. It might get a little bit enlarged, but as the infection is controlled, then the size of that knot goes down. Most of the time, doctors will get a little bit concerned or nervous if the area is getting bigger, or if it's tender, or it's swollen, or there's any other skin changes that are around it or above it. And certainly if you have other physical symptoms such as weight loss or fever, fatigue, any of those things, then we might get a little bit more interested or think that it's related to something sinister. We certainly will do some blood work. We'll normally throw in some sort of x-ray, such as an ultrasound or a CAT scan, again, to get better definition of the size of the nodule, where it is, if it's fluid-filled, if it has pus in it, if it's just air. And then last case is certainly doing a biopsy or having it surgically removed. So typically, most of those things would not have to be dealt with. They can be monitored, but certainly if it doesn't go away, if it gets bigger, if it has some other concerning symptoms, we look into it more aggressively. If you have any other questions on Ask the Doc, give us a call.